How to use the QuickVue COVID-19 self-test. Wash your hands and make sure they are dry before starting. Open the box. Your test kit contains 2 tests. There will be 2 tubes, 2 swabs, and 2 test strips. Place the tube in the tube holder and remove the cap. Remove the swab from its wrapper, being careful not to touch the swab end. Gently insert the swab into a nostril. Firmly rub the swab in a circular motion around the inside of your nostril, at least 4 times. Repeat this with your other nostril. Place the swab in the tube, making sure it touches the bottom. Stir it 4 times in the liquid. Leave the swab in the liquid for 1 minute. Remove the swab from the tube by rubbing it against the inside wall of the tube, squeezing out as much of the liquid as you can. Throw the swab in the trash. Open up the test strip. Place the test strip in the tube with the arrows pointing down. Leave the test strip in the tube for 10 minutes. Remove the test strip from the tube. A negative test result, which means you do not have COVID, will only show a blue line and no pink line. If you have COVID, there will be both a blue line and a pink line near the blue line. Look closely. Even a very faint pink test line and a blue line is a positive result. These are all examples of a positive test for COVID. When you are done, throw all the used kit pieces in the trash.